Africa Youth Growth Foundation, a non-governmental organization set up with the sole purpose of contributing to positive change in the economic and social status of Africans, the poor, the vulnerable, and minorities through effective programs that deliver sustainable outcomes, has commemorated this year's World Malaria Day with advocacy and sensitization workshops on prevention, detection and treatment of malaria. The 2024 event is marked with the theme Accelerating the Fight Against Malaria for a More Equitable World. As part of the Foundation thematic areas, improvement of public health through an AYGF-infused intermittent preventive therapy for pregnant women, a malaria prevention component that focuses on pregnant women, and the administration of sulfadoxine and pyrimethamine at the beginning of the second trimester, reaching over 2 million women in three northern states, Niger, Kogi and Katsina, has drastically reduced malaria among pregnant women. Participants acknowledge the progress made so far, calling on communities, individuals and governments to collaborate more in order to end the transmission of malaria in the country.
According to reports by the World Health Organization, infants and young children continue to see the greatest mortality. In 2022, an estimated 4 out of 5 malaria-related deaths in the African region were among children under 5 years of age. Pregnancy has also been known to reduce women's immunity to malaria, making them more susceptible to infection and increasing their risk of severe disease and death. If left untreated, malaria in pregnancy can cause severe anemia, maternal death, stillbirth, premature delivery, and low birth weight in babies. Public health is one of AYGF's 7 thematic areas, with a major focus on malaria, gender-based violence, mental health, and nutrition. Through the ARIN project, that is the Accelerating Nutrition Results in Nigeria, a World Bank-funded project, AYGF-infused intermittent preventive therapy for pregnant women, IPTP, a malaria prevention component that focuses on pregnant women and the administration of sulfadoxine and pyrimethamine monthly at the beginning of the second trimester. Through this intervention, AYGF in 2 years has reached up to 1,373,674 pregnant women in Niger State alone, and then 273,976 pregnant women in Katsina State, and 727,679 in Kogi State. These are the 3 states where we implement the funded ARIN project in Nigeria. We are making the following recommendations both to the government and other stakeholders in the sector. Number 1, engaging communities in health decision making. Community needs are best addressed with the environment of its members, with involvement of its members, soliciting for buy-in that ensures sustainability after intervention. These interventions can be sustained when community members see the need and drive the cost, ownership, and transcending in improved results long after the intervention has ended. 2, addressing factors that increase malaria risk. Malaria is an ever-growing issue that will continue to affect and spread throughout Nigeria if measures are not put in place. Sensitization and awareness campaigns enlightening on healthy practices, bringing healthcare closer to the people to prevent malaria and reduce the prevalence of diseases in the country. Another app is to improve access to healthcare among vulnerable communities through the delivery of affordable healthcare to hard-to-reach communities across the country. 3, adoption of universal healthcare coverage. In Nigeria, a large part of this country currently falls in the low-income category of living, making affordability of healthcare quite cumbersome. Therefore, a need to adopt universal health coverage, ensuring that all people have access to a need to adopt universal health coverage, ensuring that all